case study number 1, and I am Kaylee Underwood. So our athlete's profile. Natalie is 19 years old. She's a female. She has a BMI of 26. She's an NCAA Division III soccer player, and her position is a forward. So sport overview of women's soccer. The game is 90 minutes long. It's divided into 2 periods, which are both 45 minutes each. You're given a halftime of 15 minutes. Within the sport, just based off of the time and the activities that the players are partaking in, all 3 energy systems will be used. For movement analysis, athletes are required to run, which then requires acceleration and deceleration. They need to pass, they need to receive, they need to shoot, they need to dribble, and they occasionally have to header the ball. So injury analysis and injury concern. So for injury analysis, Natalie previously tore her ACL and MCL. She is 6 months post-operation and is now cleared for rehabilitation. Some injury concerns that I have: the risk of re-injuring her ACL or MCL, atrophy that was caused from being out, the strength between her quad and her hamstring. So that ratio, we want that ratio to kind of be as close as possible because that reduces the chance of Natalie becoming injured. And then compensation. So as we start this rehabilitation program, is Natalie in pain? Is her knee sore? Does she start to compensate through these activities using her other leg? We want to limit this as much as possible because then she won't get the full effect from this training program. So to begin, for testing, I would start with the bod pod. As stated before, her BMI is 26, which suggests that she's about 20% overweight. BMI is a prediction rather than an accurate measure, so the bod pod is a little bit more accurate. So if we go ahead and throw Natalie in the bod pod, we'll be able to see if this BMI is a concern of ours or not. And then I would go with range of motion on using a goniometer. I'm doing this just to kind of see, is the range of motion from her injured leg to her non-injured leg, are they pretty equal, or is that something that we need to work on within this program? And then agility, we'll go ahead and test agility because it is something that will be used within her soccer. We'll use the pro agility for that. And once again, she is coming off an injury, so I don't expect this to be something that's going to be a great number, but it gives us that baseline. And then 3 months from now, when we do testing again, we can see, okay, this rehabilitation did work and Natalie has increased in there. Secondly, for strength, I want to go ahead and do a hamstring strength test and a quad strength test. So this will be a leg curl and leg extension. Once again, I'm just seeing from the difference between her right leg to her left leg, and this will kind of help us determine, do we need to do unilateral things within our lift? Do we need to do bilateral things within our lift? And then we'll go ahead and do a test to measure anaerobic endurance. This could be something like the 300-yard shuttle. So in terms of periodization for Natalie's program, I'm going to go with a linear block periodization. This is kind of ideal for most sports because it allows an athlete to go ahead and peak at a certain point. Right now, that's not really our main concern because we are just kind of taking Natalie from post-operation and we're going to have to build her back up to that peak. So if we look at the phases, we have accumulation, transmutation, and realization. We're going to go ahead and be in that accumulation phase. That's like our foundation phase. Once again, I'm going to use block periodization because it allows us to be specific. What block, what are we focusing on? Block 1, are we focused on hypertrophy? Then we're going to strength endurance. Then we're going to max strength. Then we're going to power. So in this 6-week program, so accumulation, obviously, as stated before, that's the first thing we're working on. We're trying to build that foundation. Natalie has not been doing much. Maybe she's been doing some upper body on her own, but lower body wise, we're going to have to rebuild that foundation. And she's probably not going to be comfortable in her own movements. You know, she's coming off an injury. So we have to be very specific with her technique and form. We're going to go ahead with general endurance, general muscular strength. The load for these lifts will be about 60% to 75% of Natalie's 1 RM. And then those repetitions are going to be anywhere from 6 to 12 reps. We're going to do 3 days of resistance training. We'll have some plyometrics and agility prior to the lift. And once again, when you go ahead and take a look at the program, you'll see those plyometrics. There's something that we work up to. It's not something that we're just starting right off the bat, giving her the hardest thing to do. We're going to have to work up just how we will with the lift, simply because she's been out for 6 months, if not more. So day 1. So the first thing we're going to be doing is just some form of an RDL. A lot of these lifts you'll see are going to come from bilateral movements to single lateral movements, because we are going to assume that there is variation from the injured leg to the non-injured leg. After the RDLs, we'll go into back squats, and then once again, we'll progress into a split squat, which allows us to go into the unilateral movement. We'll pair that with some clamshells. Then we're going to go ahead and do some dumbbell bench, and then some dumbbell alternating bench. Once again, bilateral to unilateral, not because they're injury, but simply because that's good for training. Then we're going to go into some planks, engaging that core within this day, and then dumbbell walking lunges to barbell walking lunges, just a little variation there. And then Pallof holds, which once again, that's anti-rotation, good for the core. Looking at day 2, we'll start with a deadlift throughout the 6 weeks. Then we're going to go into a front squat without the 6 weeks. And then with the front squat, we're going to pair the lateral banded walks, the TRX row. And then with the TRX row, we'll go ahead and pair that with some dead bugs, once again, for that core, some Nordic falls, which are going to be some hamstring strengthening things, and then push-ups. After that, we'll go into some of our Olympic lifts, still keeping that load anywhere between 60 to 75%. Then goblet step-ups. This helps us with the unilateral movement. We'll go ahead and pair that with some midway sprints, because once again, within soccer, Natalie will be sprinting. So that's something that we're going to go ahead and add into our training. Then we're going to go barbell inverted row, banded pull aparts, stability ball hamstring curls. Once again, we really want to engage those hamstrings and quads. And then an earthquake series to wrap it up, to once again just engage that core and make sure we're strengthening that for Natalie. One thing I do want to say here, if we look back at all these days, so our loads are always staying somewhere between 60 to 75%, just based off of the block that we're in. And with the repetitions, yes, they are higher, but since the load is lower, that means we're kind of at a lower intensity workout. The reasoning for this is because there's an article by Barcelona that showed that lower intensity is better for ACL injuries compared to high intensity workouts. It showed that lactic acid within and around the knee was lowered by 133 compared to high intensity workout within a 12-week program. So to kind of wrap that up, they divided people into 2 groups. All of these individuals had ACL injuries. Half of them went high intensity workout, half of them went low intensity workout for 12 weeks. And the lower intensity group had less lactic acid around their knee and reported less pain, less soreness. So that's kind of why you see here throughout these 3 days, we're keeping it at a lower intensity. And then here are my references.